Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. When it comes to healthcare, it truly takes a village. Ladies, welcome to Here for Good.
Thank you.
Thanks for joining me. I feel like I just entered a family reunion or something, but it brings new meaning to the word Virtua family. And so I really do appreciate you joining me today to have a chat. Christine, let's start with you because obviously this all got started with you. Take me back. What drew you into nursing?
Well, when I was a little girl, my dad worked for the post office, and he used to bring home undeliverable magazines. And there were a million foreign magazines. And I would just sit there in my room and just go through them. And I saw all the ads and all the articles. And I'm like, wow, this seems really neat. So I just always wanted to be a nurse from that. And then I just always had a passion for babies, maternal child health, and global issues with maternal child health. And I just carried that through. And when I first became a nurse, I went in the NICU.
And how long ago was that?
36 years ago.
Wow. 36 years. So obviously that says you have a strong tie to Virtua.
Yes.
What's kept you here for so long?
It's the family dynamics. It's the relationships that we make with our coworkers and other team members in other departments. And it's just, I see the quality care that we give, and it just makes me want to keep going.
So the two of you grew up in a household with someone who had truly dedicated her life to nursing. Was it your mom as an example or this role model, or talking about nursing around the dinner table, or what was it that drew you in?
She never really brought work home, which is
That's
always
good
a good
because
thing.
her patients are in the hospital.
Yes. So she never really brought work home, but she did always guide us. I remember specifically a time when she pushed me to volunteer here in the emergency department. It was when the employees' children can volunteer for a summer here.
Okay.
I volunteered in the emergency department here and absolutely loved it. You know, that got me started. And then my grandfather got sick, and we were seeing a lot of the nurses and caretakers with him. And that really fueled me to want to become a nurse.
But something at some point also created this desire for you to work in behavioral health.
So behavioral health is something near and dear to my heart. I worked in Virtua Health as my very first nursing job on a medical surgical unit there. And we saw a lot of behavioral health patients on the floor that I worked on. And I really, truly believe that when we can get to that patient's level and really understand what they're going through and be compassionate and provide that compassionate care to them, you can really help them thrive when they're getting the care that they need in their mental health journey. And I really, truly believe that if we can feel that and we can, connect with them on that level, we will be able to do a much better job in caring for our behavioral health patients.
So speaking of connecting, did you convince your younger sister to go into nursing?
We did. She can speak on that, but I think that between the two of us,
twist your arm back.
I will say, I don't think either of them ever sugarcoated the career and what it entails. And I think that helps me ultimately, because you don't want anyone to go into a career thinking it's sunshine and rainbows.
But what was it that sort of pulled you in?
Our dad, he always taught us it was more so about having a career that sets you up for success. And for me, that was something that could take me anywhere. There's so many avenues, so many different ways we can go in nursing. And I think he just pushed us in that way to do something that we know can take us anywhere.
So we got behavioral health, and we have what you say, is it maternal health or neonatal, and then we have orthopedics.
And stroke.
And stroke.
Yep.
So what was it about that particular specialty?
So actually, initially, my career was going to be physical therapy. It was very overpopulated at my school.
Mine too, but then at some point I realized I wasn't that smart, so I had to give up on PT. I know. So we share something in common.
I played field hockey at Delaware, so I had the sports, orthopedic stuff in my history a little bit. I took a little bit of a different route. My grandma had a stroke. My uncle had a stroke. So we I think all of us kind of took a love for caring for people in that sense. And then specifically the strokes. So when I came over to Virtua, that was the unit I initially went on to. Actually, we do both. So we do stroke and ortho on the same floor.
What do you love most about not just working in orthopedics and stroke, but your Virtua family and being part of this organization?
I think ultimately, we can all say that Virtua, any department, any different dietary, PTOT, transport, we have family in them. And I instill that in all my employees. And, we respect all different departments and we have to all work together to be on the same page.
How do you feel knowing that you've inspired two very talented professionals to go into a field that you love so much?
Now, I am the proudest person on the planet. And I raised them to care for people, to be respectful of people, and I see it in them, in their jobs. And, to experience that every time I go to work, it's really empowering.
You have a son.
Yes.
How old is he?
16 months.
16 months. And so if he were turning 18 and he asked you about your career choice and your path and what is it that you love about it and why you have chose this particular path, what would you say?
It's a job where you can show your compassion to people, care for people, and you really can go anywhere with a nursing degree, and there's lots of different avenues. And if I raise him right, which I will,
You had a great example.
he will be a very kind, compassionate little boy. So, and I know that he will take that no matter what career he goes into.
We mentioned you've been here for an extended period of time. And obviously, we all went through the pandemic, which was a difficult time for most. What have you been able to do to keep you sort of invigorated, coming to work every day and doing the things that you do to make sure that we're here for good?
All three of us helped the community during that time. We volunteered at the vaccine clinic, and all three of us would do that. And that actually, believe it or not, kept me going throughout the pandemic because I knew I was making a difference.
And that's really what's important, is to connect, the why are we here and what we're doing. If someone were to ask you to film a commercial about nursing and the things that you find to be so meaningful and impactful, what would you say?
I think specifically in my environment and my department, when we see people with such acute illnesses, and I think when you treat people like human, that's what's most important. And remember that they have basic needs. And I always remind my staff that, it might seem silly to cut up their breakfast or add some salt and pepper, but that's really the basic human needs that we have to get back to. Just the simple act of sitting down next to someone, having a human conversation is huge. That's the most important part of being a nurse, is having the compassion and the empathy to be a human with the patient.
And it matters because that authenticity can be, people pick up on that and they feed off of that. 36 some odd years later, do you feel just as excited about coming to work today as you did many years ago?
I do. Everything changes all the time. So it's really fulfilling to be a part of whatever's happening at the time, learning new things, meeting new people still after all this time. That people come and go all the time. Absolutely. I feel just as grateful.
This has been great, and I can't thank the three of you enough for joining me to share, what it is about nursing that fulfills you and the love and compassion and all that you give to this field, to this organization and this community. So thank you for being here for good.
Thank you for having us.
It has been great really having a chance to engage with members of my extended family now It's always wonderful to talk to our colleagues that are truly making a difference. So please tune in for the next episode of Here for Good, the Inside Edition.